what's helpful for you to know from a patient that helps you with that initial diagnosis?
So when we're first sitting down with the patient, trying to wrap our heads around what the diagnosis is, the symptom burden associated with it, and I'm trying to understand from the patient where they are from a symptom perspective. I do try to take the time to describe what myelofibrosis is, both biologically, but clinically, try to put it into perspective. I do try to give them a sense of like timeline, how the disease can change over time and symptomatology can evolve and progress. And then I try to get a sense from them, like, what are their major symptoms? What affects them the most? What are they looking to achieve? What is reasonable expectations? I think creating a picture so the patients understand, perhaps, like, for example, the complexity of their symptoms and what could be driving their symptoms. The fact that in some cases anemia can drive like fatigue or aspects of fatigue, and that might be a treatment goal of improving anemia. The fact that the disease is myelofibrosis, there's fibrosis or scarring in the bone marrow, I try to explain to patients, but ironically, that's not always a target, or that's not always a goal of necessarily reducing the fibrosis per se. For some patients, it might be trying to get them up and out of a chair so that they can carry on with their lives. That's a more important goal, or getting them out of the transfusion suite, reducing their spleen so they can eat better. So trying to help patients understand the relationship between their disease features and characteristics, the symptoms, and then what we have at our disposal to try to address those, and trying to prioritize like what's important for that patient. And for each patient, addressing different things may be more or less important, and that's a discussion that you need to have with the patient.